Hi, my name is Greg Law with Laws of Motion Physical Therapy. We're going to go over some cervical or neck strengthening exercises. So one of the exercises that we really want to focus on is trying to get those deeper muscles in the neck to start engaging. So we're going to start in a supine position to land on the back. Coming up here, we'll have the head in a relatively neutral position with the chin slightly tucked. I'm going to place the tongue on the roof of my mouth. That's going to get my glottis and my tongue muscles essentially to engage. Bringing my hand underneath my chin, and I'm going to gently start to build up pressure underneath my chin, almost like I'm trying to turn my head up like that. But there's not going to be any movement occurring. I'm going to start low and slow and build up my pressure. So it's going to be here to there, just building up pressure until I start to feel a little bit of shaking, or it really feels like a lot of the muscles are engaging, and I'm just going to hold that. That's going to be an isometric hold. We can progress from that to taking the hand away. And all I'm going to do is just slightly lift my head, almost like I'm trying to slide a piece of paper underneath the back of my head. So I'm not lifting here. I keep that slight chin tuck, and I'm just barely lifting my head off the floor so that my hair is still touching the floor. The next one we're going to do is in a side lying position. I'm going to try to segmentally side bend my head. And I'm going to bring the other hand here. I'm going to start to build up pressure. And I can test, do I feel weaker here? If I rotate my head up, do I feel weaker here? Or if I rotate down, do I feel weaker here? For me, I feel weaker when I look straight ahead. So I'm just going to sit here. We're going to hold that into a side bent position. Then we're going to move even more of an upright position, working on some rotational strength. I'm going to bring a band behind my head in a quadruped position, and I'm just going to rotate as far as I can to the right, and then come to the left. Again, keeping that chin tucked, not letting my head shift up like this, but really keeping that tuck. The next thing I want to do is starting in this position again. I'm going to move the band just slightly down my neck to where it's right on my cervical spine. Now I'm going to press up into the band and hold, and let that relax just a little bit. And up and hold. Again, you're not going to see much movement, but you want to try to think about the vertebrae, relaxer, and pushing back. All these are great for improving some of the strength in the neck to help hold the bowling ball on top of your shoulders.